Hey everyone, this is Holly Knutson. I'm a holistic cancer coach and FDN from Utah, and today I want to talk about the signs and symptoms of Ewing's sarcoma. Ewing's sarcoma is an aggressive type of bone and soft tissue cancer that primarily affects children and teenagers. The prognosis is good if the cancer is caught in the early stages before it is spread. Fortunately, Ewing's sarcoma is a rare cancer, occurring in approximately 1 out of every million people in the U.S. However, 10 cases per million people include adolescents between the ages of 10 and 19, and this results in 200 cases diagnosed annually. There are two main types of cancer, sarcoma and sarcoma. The former is the most common type of cancer. Carcinomas develop in the epithelial cells, which surround internal organs and line the surfaces of the body, including the skin, urinary tract, and blood vessels. These cells provide a protective barrier against outside forces such as bacteria and viruses. Epithelial cells are shaped like columns when viewed underneath a microscope. Carcinomas typically affect the mucous membranes in skin. Basal cell, squamous cell, transitional cell carcinomas, and adenocarcinoma are the most common types of epithelial cancers. Sarcomas develop in the mesenchymal cells in the bones and soft tissues, including the tendons, muscles, and blood vessels. Mesenchymal cells are multipotent stromal cells that have the ability to differentiate into other types of cells, and these cells include osteoblasts in the bone, myocytes in the muscles, chondrocytes in cartilage, and adipocytes in fat cells. Stromal cells are connective tissue cells within the organs, including the lymph nodes, prostate, ovary, and uterus. Sarcoma tumors develop in the bone, cartilage, joints, tendons, ligaments, muscles, fat, nerves, and blood vessels. There are over 75 types of sarcomas, with most occurring in the legs, arms, and abdomen. 85% of Ewing's sarcoma occurs in the bones. Other types of sarcomas include undifferentiated pleomorphic sarcoma, which develops simultaneously in the bones and soft tissue. Leiomyosarcoma, which is cancer of the smooth muscle cells in the GI tract, uterus, and blood vessels. Liposarcoma that develops in fat cells, and osteosarcoma, which is cancer of the bone cells. Peripheral primitive neuroectodermal tumor, abbreviated PNET, is a type of tumor that develops in the nerves in various parts of the body. Approximately 90% of all types of cancer are carcinoma, with sarcoma being much more rare. Approximately 90% of all types of cancer are carcinomas, with sarcomas being more rare. Well, how do tumors develop? The human body is made up of trillions of cells. These cells are constantly growing, dividing, and replacing old damaged cells. Cancer is the result of this process no longer functioning as it should. When old cells are no longer replaced by new cells, they can divide uncontrollably to form tumors. Tumors are abnormal growths of tissue or malignant masses caused by the proliferation, division, and spread of cancer cells. Tumors can be deadly because as they increase in size, malignant cells can break off from the tumor and travel to other locations in the body via the lymph or bloodstream. New tumors can then form in new locations, which may be far removed from where the original tumor developed. Cancer cells can negatively affect normal cells, blood vessels, and molecules that surround a tumor, enabling its growth by creating new blood vessels, and this process is called angiogenesis. New blood vessels feed the existing tumor by supplying it with nutrients and oxygen. This allows it to grow and thrive. Waste is also removed by these new blood vessels. Metastatic cancer is cancer that has spread from its original location. Advanced cancers are referred to by the same name as the original cancer. So, for instance, breast cancer that has spread to the bones or lungs is not called bone or lung cancer, but rather metastatic breast cancer. And this is because the malignant cells look the same as the original cancer cells did. Well, how is Ewing sarcoma diagnosed? Physical exams are used to diagnose it, along with various other diagnostic testing methods, such as biopsies, bone marrow aspirations, bone scans, X-rays, and CT and PET scans, MRIs, and blood tests. What testing methods are used depends on several factors, including the type of cancer that is suspected, the location and size of the tumor, if metastases is present, the age of the patient and the symptoms they're experiencing, along with the general state of their health and the results of previous testing. A biopsy is a definitive way to determine if cancer is present in the suspected area. Small tissue samples are taken from the area of growth and sent to a lab for evaluation, and children are typically put under anesthesia for this procedure. And if for some reason a biopsy is not able to be taken, other testing methods are used. Blood tests, notably CBC or complete blood counts, analyze red and white blood cells and platelets. Cell abnormalities are red flags for tumor growth and metastases. Bone marrow aspiration combined with biopsy removes cells from the bone marrow to check for cancer, and this procedure is performed under a local, quick-acting anesthetic that is injected into the skin to reduce pain, with the option to use general anesthesia instead. The liquid portion of the bone marrow is removed during an aspiration, with a biopsy immediately following. A biopsy is performed in case the bone marrow that was extracted during the aspiration didn't contain enough malignant cells to make a diagnosis. Imaging tests, CT scans, PET scans, and MRIs take images of internal organs to look for tumors or other abnormalities along with their size. And specifically for Ewing sarcoma, CAT scans of the chest are used to see if there is metastasis in the lungs. X-rays use a small amount of radiation to take pictures of tissues and organs to detect bone tumors. And bone scans are nuclear imaging tests that are used to diagnose bone tumors and metastatic bone cancer. Small amounts of radioactive tracer is injected into a vein, and areas of repair in the body take up the most amount of this tracer. A radiologist then evaluates the scan for abnormalities in bone metabolism. Areas of bone that contain a tumor appear dark and are referred to as hot spots, whereas healthy bone appears gray. What are the causes and treatment of Ewing sarcoma? Well, Ewing sarcoma is not an inherited cancer, and how it develops is unknown. The disease does, however, correlate to changes seen in certain non-inherited genes that can occur during a person's lifespan. 2 chromosomes, specifically chromosomes 11 and 12, have the ability to exchange genetic material. This exchange can stimulate cell overgrowth, potentially leading to Ewing sarcoma. And it's also surmised that Ewing sarcoma may be a secondary cancer in people who have been treated with radiation for a previous cancer. How bone cancer is treated depends on the location and size of the tumor and where it has metastasized. While there is no standardized treatment for Ewing sarcoma, conventional options include surgery, chemotherapy, radiation, stem cell transplants, and targeted proton therapy. Some patients choose to incorporate alternative cancer therapies into their treatment protocols. Immunotherapy, stem cell transplants, and monoclonal antibody therapy are used for advanced bone cancer. Now I want to talk about the signs and symptoms of Ewing sarcoma. In 1920, Dr. James Ewing, who was an American pathologist, discovered a type of malignant bone tumor that develops in soft tissue and bone, notably the ribs, hip bones, shoulder blades, and long bones, including the femur, tibia, and humerus in the upper arm. It's common for sarcomas to initially develop in the pelvis or thigh bone. Sarcomas can metastasize to other locations in the body, namely the lungs, adrenal glands, liver, bone marrow, kidneys, heart, and other soft tissues. Although Ewing sarcoma can occur at any age, it commonly develops during puberty, and this is most likely due to rapid bone growth during this time. More males are affected by the disease than females. Interestingly, this type of cancer rarely occurs in those of African or Chinese descent. Caucasians are 9 times more likely to be diagnosed with the disease. Pain and swelling in the area of tumor growth are the most common symptoms of bone cancer. The area may be warm to the touch and develop a lump on the surface. And here are some other symptoms: a chronic low-grade fever, loss of appetite, stiffness, limping, anemia, pain that worsens after exercise, unintentional weight loss, unexplained fatigue, a general feeling of malaise, or breaking a bone for no apparent reason. Sarcomas that develop in the pelvis, chest, arms, or legs may have corresponding symptoms related to that specific area. For example, a person may have difficulty breathing if the tumor is in the chest area. Treatment is less successful for cancer that has spread, with 5-year survival rates hovering around 70%. In summary, like any type of cancer, Ewing sarcoma can be extremely frightening, and particularly so because it occurs in young people. It is the second most common type of childhood cancer and is responsible for 1% of all childhood cancers. It's rare in adults. Ewing sarcoma is found in the long bones of the body, but can develop in any bone, along with the soft tissue and muscle surrounding the tumor. If you or someone you love has any of the symptoms I mentioned, please schedule an appointment with your doctor so the cancer can be detected and treated in the early stages for the most favorable prognosis. Do you know someone who has or has had Ewing sarcoma? Let me know in the comments. Thanks so much for watching.